When we talk about hypertension or blood pressure, we are talking about the systemic channels of the blood. And when we talk about pulmonary hypertension, we are talking about the channels which are interconnecting heart to the lungs. And there are small channels or small vessels of the blood which are called pulmonary arteries. And whenever their pressure is higher in the pulmonary artery, it is labeled as pulmonary hypertension or pulmonary artery hypertension. These are classified into 5 categories. So first category is idiopathic, where we do not know the exact cause of the pulmonary hypertension, but we know that there is hypertension in the pulmonary arteries or pulmonary vessels. But in the other part or the second, third, fourth disease, we know that because of clot in the blood vessels of the lungs or pulmonary artery, we get pulmonary artery hypertension. That is because of pulmonary embolism or clotting in the vessels of the lung. Then there are causes like whenever a patient has chronic long-standing lung disease, the blood vessels or the blood pressure in the pulmonary arteries rises, and which is labeled as cor pulmonale or pulmonary artery hypertension secondary to lung diseases. The PH secondary to lung diseases. Then we have subset or the causes related to heart diseases. So primary heart diseases like valvular diseases of the heart or left to right shunt, all these kind of diseases can actually lead to pulmonary hypertension because of heart disease. Then we have other miscellaneous causes like a patient of chronic kidney failure, patient of HIV, patient of sarcoidosis, patient of destroyed lung, or patient of autoimmune disorders. All these patients can also get pulmonary hypertension. So these are multiple causes of pulmonary hypertension, and they have been classified into different categories, and their treatment will depend on the cause of it and the underlying disease of it. Pulmonary hypertension is one of the very enigmatic thing because almost 70 to 80% population, general public doesn't have any understanding of this thing. And roughly 1/3 of doctors do not think about it, do not address this disease. But the symptoms are very common. Breathlessness, and which is most often exertional breathlessness, which appears on walking, on talking, on climbing stairs. Then syncope is another symptom, which is very important symptom, presenting symptom of pulmonary hypertension. Then syncope is like sudden loss of consciousness or blackouts, which can be frequent, which can be exertional, and this pulmonary hypertension can be one of the cause of syncope. Then pulmonary hypertension can also, like patients of pulmonary embolism, may have sudden onset chest pain. Then patients who have chronic lung disease, they will definitely have the baseline breathlessness, which worsened because of pulmonary hypertension. So breathlessness, exertional dyspnea, syncope, chest pain, these are common symptoms of pulmonary hypertension. Any patient who is suffering from a chronic lung disease, in the advanced stages, they will develop pulmonary hypertension. Any patient who has heart disease from young age, like valvular heart disease or left-right shunt disease, these patients will gradually develop pulmonary hypertension. The patient of cancer or immobile patients who have tendency to develop pulmonary embolism will develop pulmonary hypertension. The people, normal people who are living in high altitudes have higher tendency of developing pulmonary hypertension. Even a normal person who is residing in plains and travels to high altitude can develop pulmonary hypertension. If the patient has got pulmonary hypertension because of low oxygen levels or because of long-standing lung diseases, definitely you treat them for their lung conditions. If their oxygens are low, you supplement with the oxygen. So you have to maintain the SpO2 level or oxygen saturation levels above 90. And if you supplement the oxygen levels, definitely their pulmonary pressures will improve. So addressing the underlying cause is the first and foremost thing. Then if a patient has heart disease or valvular heart disease, which is causing pulmonary hypertension, by interventions, by surgical methods, by valvular replacement, their pressures will definitely normalize. Then if a patient has idiopathic pulmonary hypertension, in those cases, there are multiple drugs, there are different drugs available Just like the systemic hypertension or blood pressure, we have multiple drugs. The same way, there are multiple drugs available to normalize or reduce the pulmonary hypertension. The important thing is you do not start those medicines without consultation, without doctor's advice, and most importantly, you address the cause of it. So if a patient has pulmonary embolism, clotting in the vessels of the lungs, you give them blood thinning agents, you give them drugs which will reduce their uh, blood clotting, will decrease the clot size, definitely improve the pulmonary hypertension. So you treat the underlying cause, you don't start the medication right away. Technically speaking, the gold standard test for definitive diagnosis of pulmonary hypertension is right heart catheterization. But the sad part is that it is very, very invasive and very, very skillful procedure, which is not practiced in 90% of even advanced hospitals and centers. So basic test for identifying or screening for pulmonary hypertension is echocardiography, which is an OPD basis test, which you can get it done on the OPD basis. There's no need to get hospitalization. And it's a walk-in test. You go to the doctor, ask for particular symptoms, or if the doctor advises you for echocardiography on heart, you can get it done anytime. So that will pick up, and that's the best screening test for pulmonary hypertension. Simple thing is that you have to suspect. First thing is high degree of suspicion that this patient might be suffering from pulmonary hypertension. If he has got lung disease, if he has got cardiac disease, if he has got immobility and there is high risk of pulmonary embolism, or if the patient has got underlying HIV, or patient has a history of sarcoidosis or systemic sclerosis or connective tissue disorder, all these things should be screened. Then you definitely, if a patient has lung disease or underlying lung condition, definitely you evaluate them for pulmonary lung functions. You check it with the PFT. So for a lung patient, you definitely go ahead with the CT scan or HRCT of the chest. So depending on the cause of PH, there will be a battery of tests which will be required. But if you ask about PH per se, pulmonary hypertension, the screening test is echocardiography. The gold standard test is right heart catheterization. In advanced stage of COPD, will develop pulmonary hypertension. So I have to intensify the treatment for COPD first. Then if the patient has respiratory failure, or if patient is hypoxic, the oxygens are low, then I have to supplement them with the oxygen support so that his oxygen is maintained above 90%. And that will definitely reduce the pulmonary hypertension. Even if there is some residual disease, in few cases, only you can start a specific medication to control pulmonary hypertension. Otherwise, treating the underlying cause, treating the respiratory failure will treat the pulmonary hypertension. Now, pulmonary hypertension per se, how it complicates is that if a patient has persistent pulmonary hypertension or worsening pulmonary hypertension, that will cause right heart failure or right heart strain pattern. In a patient who is pulmonary embolism patient and has got right heart failure, you have to treat the pulmonary embolism. You have to give them blood thinners depending upon the severity of the disease, and then only you will be able to treat the pulmonary hypertension. So pulmonary hypertension will cause heart failure, and most specifically the right heart failure. None of the dietary supplement which actually treats pulmonary hypertension, there is nothing like that. But like in a blood pressure patient or in a hypertensive patient, we suggest that you have to reduce your salt intake. In a cardiac patient, we suggest that you have to reduce your fluid intake. There is a fluid restriction regime which you have to follow. Similarly, in the pulmonary hypertension patients, they should not be dehydrated and they should not be overhydrated. So there is a very, very critical balance of fluid which they have to maintain. They are advised to continue with a limited amount of fluid. They cannot reduce their fluid intake. They cannot increase their fluid intake. And definitely the salt is one thing which can precipitate hypertension and pulmonary hypertension as well. Simultaneously, if the patient has got pulmonary hypertension, going or traveling to high altitude is going to worsen their problem. So they are advised to avoid air travel. They are advised to avoid high altitudes. Even if in any condition, if they have to go for air travel, they will need oxygen supplementation. They will need clearance from their treating doctor. All these things are to be taken care of. There is no fixed rule for preventing pulmonary hypertension, I'll tell you. Because in a case of dengue, we know that dengue or malaria spreads because of a vector, which is mosquito. So if you control mosquito, you can prevent the disease of malaria or dengue. But when a disease has multiple factors or multiple causes, like heart disease can cause PH, lung disease can cause pulmonary hypertension, HIV can cause pulmonary hypertension. Pulmonary hypertension can be because of high altitude inhabitants. Pulmonary hypertension can be in idiopathic or familial pulmonary hypertension, which travels in the family. So there cannot be a single or fixed rule to prevent this pulmonary hypertension. But if you talk about pulmonary hypertension in pulmonary patients, definitely if their lung condition is treated well, like asthma or COPD or their ILD or lung fibrosis is treated well, and if you prevent or if you treat their respiratory failure as well, definitely you will prevent the development of pulmonary hypertension. If you come across a patient who has got valvular heart disease, if you treat them early for their valvular heart disease, definitely the pulmonary hypertension can be prevented. So there is not a single fixed thing to prevent pulmonary hypertension, but as per the risk of the patient, if a patient has got HIV, you monitor them, you monitor their lung functions, you monitor their cardiac functions periodically so that they don't develop or they don't present in an advanced stage of pulmonary hypertension. So you have to keep screening and preventing them. There is not a single fixed rule for prevention of pulmonary hypertension.